Hello and good afternoon. Thank you so much for joining the Bloomberg Fellows Program webinar where we will be discussing our environmental challenges focus area today. My name is Shannon Jones. I'm the communications manager here with the Bloomberg American Health Initiative, and we are so excited that you all have taken time out of your schedules to join us and to be a part of the discussion. I just want to go over a few housekeeping notes before we get started with our content. This is an audio-only webinar, so please be sure to mute your devices. The great thing is we are hosting a Q&A session after we go through the presentation. So feel free at any point to type in your questions in the chat portal. Tech support is available to assist if you have any technical issues. But we welcome all questions, and if there's something that is unclear or you'd like more understanding, by all means, please feel free to type your questions in. Also, this webinar will be recorded. After the presentation concludes, we'll be sending the recorded link out via the Eventbrite portal, and it'll be posted on our YouTube channel. And our YouTube channel is Bloomberg American Health Initiative. And on that YouTube channel, we've had a series of webinars highlighting each of our focus areas in the program overall. I think there's one more, our addiction and overdose webinar that is scheduled on the 26th of this month. So feel free to take a look at YouTube and to share with your networks and your colleagues. Without further ado, I'd like to go ahead and introduce our guest for today. We are joined by Jennifer Spiller, who is one of our current Bloomberg Fellows. Jennifer works with the Healthy Homes Coalition of West Michigan. Jennifer works as the Direct Services Program Manager. In addition to Jennifer, we are excited to have her Executive Director of the organization join us, Mr. Paul Hun. He's also with Healthy Homes Coalition of West Michigan. In terms of the initiative staff here joining us today, we are joined by Faria Zaman, who's our fellowship officer, and Shane Bryan, our partnership and engagement officer. So again, we are super excited that you guys are joining us today, and we are ready to explain and provide all the opportunities that exist and that are available to you through this program. So Shane, without further ado, I'd like to turn it over to you.
Shannon, thank you so very much. And hello, everyone. We are so excited to have you with us electronically on this webinar. And it is a pleasure to see so many folks who have logged in to the live recording. And to those of you who are watching, we are excited that you're tuning in as well. So we're going to give a brief overview of what it is that we're doing here at the Bloomberg American Health Initiative. We'll talk a lot about the Bloomberg Fellows Program, particularly the environmental challenges focus area. And there's going to be a lot of opportunities for you all to ask questions. So we will get to your questions at the end of the presentation, but please do, as you're listening and as a question comes to mind, use the chat function to add your question in. And we might get to it later in the presentation, but we might not. And so as you have questions, please do go ahead and add them to the chat function, and we will be able to address them at the end of the presentation. So to get us started, the Bloomberg American Health Initiative, what we're seeking to do here is, quite frankly, improve the health of the United States. And we know that we cannot do this without working with you all who are in communities across the country on the front lines and working on improving your community's health. And so we seek to build collaborations and partnerships with organizations who are providing those direct services and who are really doing the work that you all are in your various fields. Now, we got started in 2016, which also happened to be the centennial of the School of Public Health here at Johns Hopkins. Mayor Bloomberg wanted to provide a gift that would have a lasting impact, and the thought leaders here at the school, along with folks at Bloomberg Philanthropies, got together and eventually came up with what is now the Bloomberg American Health Initiative. Now, in 2016, we were first getting the report of the decline in life expectancy that we saw in 2015, which was the first in many years here in the United States. And unfortunately, we've seen that life expectancy decline over the past 3 years. So our work is, quite frankly, to work with you all, with your organizations and the current fellows and organizations to really address what we believe are 5 incredibly important areas to focus our energy, our time, and our research in those areas to improve the health of all of our communities. And so those areas, we call them our focus areas, are addiction and overdose, adolescent health, obesity and the food system, environment, and violence. All of our work falls within these 5 areas. And we take a broad approach when we're considering what fits into a focus area. So since we're doing environment today, we'll use environment as an example. And a lot of the work that we do certainly falls within climate change and air quality, but we are also really wanting to look at a community's built environment. And we understand that the built environment of a community greatly impacts that community's health. Thinking about access to public transportation, also thinking about air quality in classrooms and how that affects young people's learning. So we take a broad approach, and also to use violence. We certainly think of gun violence, but we also think of intimate partner violence, community-based violence, suicide. All of that falls within the violence focus area. Across all 5 of these areas, we do take an approach that allows for your work at your organization to be able to demonstrate how that fits into the focus area that you would like to focus your work on. With the 5 focus areas, we also have 3 cross-cutting themes: equity, evidence, and policy. Now, when thinking of equity, we are mindful of our approach as a national initiative to be present and engaging with communities across the country. That means certainly urban, rural, suburban, the coast, middle America, the deep south, all the US territories. And so we want to find opportunities to get the word out to those particular communities so they're aware of the opportunity for the Bloomberg Fellows Program and can be part of the work that we're doing here at the initiative. Also within equity, we're looking to engage and support individuals with a diversity of lived experiences. This is a very unique opportunity here for the Bloomberg Fellows Program to assist in diversifying the field of public health. Now that means bringing folks in who haven't taken a traditional path to public health. Maybe they have been in a career that, let's say, urban planning, and hasn't considered their work to be directly public health related. But we know that that work of planners and others of you who are on the webinar today does directly affect the work, the health rather, of your community. And so within equity, we're thinking about ensuring that individuals are coming from and have a lived diverse experience. Within evidence, we are thinking about the data management systems and ensuring that we're using the data to not only inform policies and programs, but to tell the story of the work. We want to support organizations in establishing strong data management systems. We want to close the gap between academic research and the needs of the public sector, so using that data to inform programs and policies and approaches in communities. And we want to ensure that our faculty and through our research, we're finding innovative ways to collaborate and connect with communities and organizations. And we support a variety of different projects that I'll talk briefly about here in just a moment. And finally, the third theme is policy. And we are looking to create critical change within policies using that data, that evidence to inform the policies and the decision makers who change the policies. We're also thinking about policies within organizations and understanding that an organization's policy can greatly affect the way that staff or individuals who are a part of that organization work with community and address the health of that community. Just a snapshot here of the numbers. Mayor Bloomberg, again, gave us the gift of $300 million back in 2016, which allowed for us to establish this initiative. We'll be bringing in and supporting up to 25 endowed faculty, and we have supported 50 Masters of Public Health fellows this last cohort, and up to 10 DRPH fellows annually. So our approach is 3-pronged. We do research, we have practice, and education. For the sake of today's conversation, we're going to focus on the education approach, but really briefly, our research is impact-based. We're looking for innovative ways for faculty to work with communities and organizations all across the country. All of our research has a deliverable. We're creating a toolkit, a program, or a policy, something that can be transferred from one community to the next. We're not looking just to create more research papers. But we really want to ensure that our research is providing in-time opportunities for communities to make changes that they need. In practice, that's where the support for the faculty come in. So the 25 faculty, 5 in each of the focus areas, these will be folks who will support you as a fellow, mentor your organizations. They'll be creating new courses, and we'll talk a little bit more about that in just a couple of minutes, but we're also really excited about that. But I know you all are here to learn and hear more about the Bloomberg Fellows Program, which falls within our education approach. So I am going to hand the mic over to my good friend Faria, who will share with you more about the Bloomberg Fellows Program.
Thank you, Shane. Good afternoon, everyone. I'm so excited to tell you about the Bloomberg Fellows Program. So this fellowship program is really, it's a unique type of scholarship program. It's impact-based, and it targets individuals who are already working on the front lines of any of the 5 focus areas. Fellows center their studies in that particular focus area, and they engage with their organizations during the course of their MPH program. And once their studies are complete, fellows will serve at least 1 year at their organization, and the organization joins an ongoing network of practice and research with the Bloomberg School of Public Health. And the initiative is working to build a very dynamic and diverse network of partnerships. And we are looking for applicants and organizations who come from very diverse backgrounds across the United States. For example, fellows might come from local governments or police departments or a small community-based organization, a housing authority, a school system, just to give you some examples. And so fellows can attend the MPH program as a fellow either on a full-time or part-time basis. The full-time is on campus here in Baltimore, and the part-time is almost entirely online. And the candidates, the applicants, they must also apply to the fellowship program with support from their organization. And when we say organization, we mean your employer. And so the applicant should be working in one of the 5 focus areas based here in the US.
All right, thank you, Faria. And here is just a few of the fellows that we currently have who are in the environmental challenges focus area. And as you can see, we have folks through a variety of organizations, some federal, some US nonprofits, larger organizations that do advocacy, grassroots organizations that, as Eli is doing here in Baltimore, working on prevention, preservation of the historical properties and infrastructures. Kelly, who's in Philadelphia, is her background is actually in athletic training and corporate wellness, which is exciting. But she uses that background to find physical healthy activities for folks in Philly through Healthy Philly to create healthy lifestyles. We have Robert, who's out in Las Vegas working for a more traditional public health organization, the Southern Nevada Health District. And his role is really as an engineer in solid waste. And so the folks that we currently have in the Fellows Program are really a great diversity in their backgrounds and the types of organizations that they are working with. Leah is with an advocacy organization based out of DC. And so it just provides you a little bit of a sense of where some of our current folks are coming from. It may allow for you to kind of see yourself in one of these roles. But if you don't see the type of work that you're doing or the type of organization that you work with currently represented here, that's even more of a reason to apply. We're always looking for folks who are coming to us from a variety of different backgrounds. And we're excited that we actually have one of our fellows, Jennifer, who is working in Michigan and can share a little bit more about her work as well as what the fellowship program has meant to her. So Jennifer, we'd like to turn it over to you and are looking forward to having you share this opportunity with the participants.
Hi, thank you for having me. So I'm Jennifer, and I work for the Healthy Homes Coalition of West Michigan, and I'm here doing the part-time MPH program. So I do most of my classes online while I work here, and so I've been the direct services program manager now for a couple years, but I actually started working here about 7 years ago, so well before the Flint water crisis. So you've probably heard about lead poisoning in Michigan, and so that's one of the topics that we address through our organization. So in West Michigan, we have an older housing stock, and so we do through our Healthy Homes for Healthy Kids program, we address lead poisoning and housing by providing in-home assessments and education, and as part of our mission of improving children's health and well-being by eliminating harmful housing conditions. We also focus a lot on asthma. So I do assessments for asthma triggers in people's homes. So looking for things like mold or pests or dust and things that can affect the indoor air quality for children. And I also conduct Healthy Homes rating system assessments for our city. So our city has a home repair program for lead, and when families go through that program, they're able to sometimes they're able to access additional funds to repair other hazards in the home. So they'll look for things like trip and fall hazards, structural hazards, things like that. And so then in terms of choosing this focus area, so I've out of college, I was really interested in how environmental contaminants affect people's health, and so when I heard about this organization and the neighborhood that I grew up in, I decided to apply, and basically I've been working here since undergrad. So it wasn't hard for me to choose the environmental focus area, although it does overlap a little bit with risk to adolescent health, but I chose to focus more on environment. Also, too, because I'm really passionate about environmental justice, and the neighborhood that we work in around here, we have a lot of, in terms of environmental health, like issues with, with lead poisoning for one. We're located in a zip code that has the highest number of lead poisoned children in the state, and we've also had some issues in this area with vapor intrusion requiring EPA intervention. So there's a lot of work to be done in this area. And then in terms of benefits of the Bloomberg Fellows program, so there are a lot. In terms of where to start, I would say I have to start with the people. For one, like the fellowship staff have been extremely supportive, and so I'm really grateful for Shane and Faria and Michelle. Overall, if there's anything you need during the program, like they're very responsive and quick to answer questions. In terms of my classmates and faculty, like as they said, the diversity of experiences are amazing, and I've been able to connect with other people in this field, and with a few people who are also working in my state. So, for example, I connected with one of my classmates he's in Flint right now. He's a medical geographer, and so we've touched base on a project recently in terms of mapping lead levels in the community. And in terms of the network, that's been great. The Hopkins name by itself has, I feel like, opened some doors for me in terms of talking to people about different projects or potential projects. So I'm looking into working on my practicum or my internship experience soon. And in terms of getting conversations with people, I think just mentioning Hopkins, like people are so familiar with it and with the great work that the school is doing, that that's been, I think that leaves an impression with people. Another thing in terms of the scholarship, I don't have any financial stress whatsoever during the program, so that's been definitely a huge benefit. And in terms of coursework, it's been really helpful to have the opportunity to dig deeper into some environmental health topics that that relate to my work, and to be able to relate my assignments back to the work I'm doing here. And initially I didn't see myself doing an online-based program when I was looking to do my master's, but I really appreciated that this was such a creative endeavor to build a network of people working on the front lines. And I thought as a way to try to make a difference in my community, where I wouldn't be doing assignments in a vacuum, but I would be using them as a way to improve my knowledge here as I'm working daily in my community. And in terms of coursework, I'm not sure where I'm at with time, but I've taken, I could go more into detail about those. For example, like I took an organizing and public health class that, opened my eyes to like the basics of, how do you change a local policy, and it gave me the experience to, investigate, how are certain decisions made in my city, and I researched how to change a local ordinance for lead testing. And so, and that was beneficial to our work here, because we have a community organizer. Actually, she just recently left, so we have a position open. But she was organizing parents to try to improve the community's approach to lead. And so I was able to pass my campaign plan on to her for her to reference with her organizing activities with the parents. And it was helpful for her in terms of power mapping and identifying people that she needed to have conversations with. So that's just one example. So, and then in terms of other coursework, taking statistics and epidemiology, that's helped me a lot with, as I'm reading like research papers that relate to my work, like understanding the methods section, so I don't have questions. Currently, I'm taking a class on climate change, which has been really insightful, because we've had, we know there's a connection to climate change and housing, but in terms of our scope of work, it's currently not what we focus on, but it could be something that we need to address more in the future in our work. And so I feel like this class has been priming me to better understand my community in terms of how we're vulnerable to the effects of climate change. And also, other classes that I've taken have helped me fill in certain gaps in my knowledge. Like, so we, in terms of addressing lead, we focus more on housing and lead paint dust, which is the main way that kids get poisoned. So I ended up taking a water policy class to fill in my knowledge about how water policy is made, and how our state has been setting standards. So that was really helpful. And also with PFAS, so you may have heard of PFAS contamination in water. We have a site near here that's had some PFAS contamination, and I was able to, through one of my assignments, research more about that, and that's helped to inform my knowledge of the area, which helps my work here. And there's future classes that are coming up that I'm planning to take that will help with my work as well. For example, like a program evaluation class. We're a pretty small nonprofit, and currently we have no one on staff that had formal public health training. So in terms of doing evaluation, we don't necessarily get funded to do evaluation. We get funded to go out and be out in the community and do things. But in terms of program improvement, things like evaluation definitely can allow us to see where we can improve and make sure that we have, that we're implementing evidence-based strategies that are current. And so I'm looking forward to taking that class and making sure that we're, on top of things with that. And yeah, I feel like I went over my 5 minutes. So,
no worries, Jennifer. No worries.
I would like to pass it on, and then I can answer questions later, of course.
Absolutely. And I believe you have Paul with you as well. Is that correct?
So my executive director is here. He's the founding director, and he has a lot of experience locally. He sits on the state's lead poisoning prevention committee, and as well as some local committees here. So I'd like to introduce Paul Hahn.
Thanks, Jen, and thanks, Shane. I really appreciate being able to be here and just give you a little bit of perspective from maybe the organization, right, that's hosting a scholar. And we don't really necessarily see it that way because we really did, when we heard about this opportunity, really did encourage Jen to engage and pursue it because I think the first thing I would say about the program is that it's been probably one of the best kind of professional development opportunities, if you will, for a small nonprofit like ours in a small Midwestern city to really connect Jen and our organization to what's going on more globally. Yes, there's obviously been a sacrifice that we've had to make in terms of the amount of time that Jen has on task on her job, and but the trade-off there has been just absolutely huge and very beneficial to us as an organization. And then Jen mentioned a little bit about just the cash of having the Hopkins name affiliated with the work that Jen's doing. For us as an organization, it has clearly kind of helped doors that maybe were already open swing a little more wide open for some of the work that we do. And I think particularly in the work that we're doing around asthma and working with a local MCO, Medicaid care provider, care organization to do interventions for children with asthma, and needing to send somebody into the home to do those assessments and to identify barriers in the home, to spend money doing that, to spend money on the interventions. The fact that we were able to say to the partner here, the payer, that the person that's doing this is a Bloomberg scholar, made them think twice about what we're doing in a favorable way, and it built their confidence that healthy homes is not just something that you read about in popular magazines or whatever, but it's actually a emerging field of study in a field of science that has very real implications for delivering health care. And so that's been tremendously beneficial. And I guess the last thing I'd say is that, your domains of equity, evidence, and policy just really fit with us as an organization. Again, we are a small grassroots community-based organization. We're very concerned about equity. The people we serve, the people affected by the problems that we work on, in the community that we're located in, and right on down to our staff and our leadership, are very concerned about those issues. As Jen mentioned, the zip code we work in and where we're located has the most lead-poisoned kids of any zip code in Michigan, and we don't often think about that as being Grand Rapids, Michigan. We often assume that might be Flint because of the water crisis, but indeed, the kinds of disparity that we saw in Flint is also present in the lead poisoning issue statewide, just in terms of housing stock in the communities, again, that are rampantly affected by this problem. The fact that Bloomberg is focused on evidence is really super important to us, again, as a small organization doing direct services, working with large managed care organizations, hospitals, other groups like that. We've known from the get-go about the importance of being evidence-based, and then the skills that Jen's learned in particular, I see that as the big value add for us. With her involvement at Hopkins has helped us really sharpen our pencil in terms of being, operating out of the evidence base. And then lastly, policy. Jen mentioned that the other side of our organization does community organizing work, does policy work, and the fact that you're making the connections between what the evidence says, what are the interventions that we can do, and how does it get supported by public policy is just huge to us. So those things just resonate 100%, and we're just pleased to be a part of this effort.
Great. Well, thank you both, Jennifer and Paul, for sharing. And Your experience and your insights incredibly valuable. And for those of you who are on participating and listening, if you have questions for Paul or for Jennifer, please use the chat function. We'll be happy to provide them the questions at the end of the webinar. And I promise we're getting close to the end, so I'm looking forward to seeing some of those questions populating here soon. So to continue on, Jennifer provided a great list of some of the courses that she has taken and some of the direct applicable learning that has provided to her organization at Healthy Homes Coalition. But here's a list of some of the other organizations for those of you who will apply into the environmental focus area. You can see there's a great diversity in the types of classes that you'll be taking, some certainly looking at a built environment, others looking at air quality and energy, environment and public health, environmental justice, environment and society. So you can just see based off of the title of some of these courses, the types of learning and instruction that will happen in the classroom. And I'm guessing most of you or many of you can see how that would be applicable to your respective career fields. So I'm going to hand it back over to Fari to talk about the format of part-time and full-time.
Thank you, Shane. So as I mentioned before, the fellowship program is open to individuals who would like to pursue the MPH program either on a full-time or part-time basis. So for the full-time format, it is an 11-month experience, and it requires completing about 5 8-week terms over an academic year. So that would be June through May. And if you're interested in the part-time, that format is almost entirely online with the exception of the first 2 weeks in June when you come for the MPH orientation, the fellowship orientation, and you also take a course during that 2-week period. And aside from that, it's almost entirely available online. And typically it takes 2 to 3 years to complete the MPH program on a part-time basis, and students have a maximum of 4 years to complete it. And on average, you take between 1 to 3 courses per term.
And we have a lot of opportunities through the program for your organizations to be a part of the work and for you to apply your learning directly into the work that you're doing within the organization. So one exciting opportunity for fellows is the Applied Experience Award. These awards, up to $3,500, are given to fellows and organizations to work on a specific project that does just that, allows for the fellows to take the learning, take things that they've gain the skills from the classroom and put it into work with the organization. So we've done data assessment projects, working to understand the context of Latino youth as it relates to establishing supportive connections within the community, like a PSA, a public service announcement or educational video around racism and gender-based violence. Another example is an assessment of a program that they were doing in the Bronx. And so these, again, just a really small group of examples of how other fellows and organizations have used the Applied Experience Award. But this is a really unique way that if you have kind of a wish list or that project that's been on the back of your mind, we're giving you the resources and connection to faculty who can help support to pull it off the shelf and put it into practice. So we are always excited about what we are able to do through the Applied Experience Awards. Now, there's a number of other ways that the collaborating organizations also can be a part of this network. Sharing and having access to best practices. As we've mentioned, policy is one of our themes, and if there are policies within the organization they would like for someone to review or have support changing, or if there's policies within that community that are affecting that community's health, be it related to any of the focus areas, we have folks here at the school who support those individuals and those organizations to advocate for policy changes. Data is always a really important piece of everyone's work, and so any support that we can provide through setting up those strong data management systems or analyzing the data that you've collected. Our faculty, we have some of the best and brightest faculty in public health here at Johns Hopkins University, and so having connections to them and their research interests are always a rich way to engage. And then something that we're really excited about as we continue to build out the network is for you all to have connections to similar organizations all across the country. We know, again, that we're not going to be able to truly turn the page and improve the health of this country without all of us working together collaboratively. I mentioned earlier on that we're supporting 25 new faculty and endowing up to 25 faculty who are going to help create some new courses based upon your needs and topics that you can identify from being on the ground in your community. Here's just a really quick list of some of the classes that faculty have developed and provided as an online format for our fellows who are doing the online part-time program. And we have many more that are going to be coming. And so we're supporting a number of courses to be developed and be provided both in the in-person and online formats. We have a list of seminars that will be coming and are provided to not just the fellows, but everyone within the organization. And so that's another way to share in the learning beyond the educational component of the fellows program. All right, so how can folks apply, Faria?
Oh, yes. Let me tell you how you can apply. Well, first of all, I'm very happy to tell you that the applications are on our website. So they are free for you to download, and so you can have a look at the fellowship applications. Now, in terms of how to apply, you have to apply to both the MPH program and the fellowship program at the same time. Now, for the MPH program, you would need to review their admissions requirements on their website. And once you click on apply, you'll be taken to the SOFIS website. And SOFIS is the name of the application processing system that the Bloomberg School uses. And so all of your admissions materials, your transcripts, your GRE, etc., all of those materials will be submitted through SOFIS. So that's how you apply to the MPH program. And for the fellowship program, as I mentioned, our applications are available online. So you just go to our website, you click on fellowship, and it will take you to the application forms for to apply to the fellowship for the MPH program. And we have two forms. One is for the applicant, and the other is for the organization. And so those forms can be downloaded, completed, and submitted right on our website, and those come to me. And we have two deadlines. The first deadline is November 1st, and the final deadline is December 1st for both the fellowship and the MPH program. And we always encourage people to apply to the earlier deadline rather than later. If for some reason SOFIS misses a transcript or something, and you wait till December 1st, you have no time to submit any missing materials. So it's always better to submit your application early. Now, if you have any questions about the application process or the fellowship program, please don't hesitate to send me an email. On the last slide of this presentation, you'll find my email. So drop me a line, and I'm happy to speak to you one-on-one on the phone to answer any specific questions you may have later on.
All right, so just a few key takeaways before we get to the pop quiz portion of the presentation. Oh, sorry, just kidding. No quiz today, folks. But anyhow, you know, all that the work that we're doing here through the Bloomberg American Health Initiative is impact-based. We know and truly understand that we are at a very critical point here in our country and dealing with the health of our communities. And we recognize that the work that we're doing must be focused on impact now, not waiting for 5 years, but really working with you all in your communities to truly make a positive impact. A critical component of the Bloomberg American Health Initiative is training the future leaders to use public health as a tool to improve their community's health. And we know that through the Bloomberg Fellows program, these individuals, you all who are applying into the program, play an incredibly important role for making that change happen today. Linking the work with your organization to opportunities across the country for collaborations and sharing best practices, we believe that we can turn the page and start to improve the health of all of our communities. We want you all to stay connected to us. So we're getting close to the end of the presentation, folks. If you have questions, please use the chat function on the screen. If you can't find the chat function, if you hover across the toolbar and click chat, it will pop open for you. You can type your questions into the chat box. But stay connected to us. Our website, americanhealth.jhu.edu, not only will you be able to find the application for the fellowship program there's lots of other really great resources for you or your peers and colleagues. We're on Twitter at American Health. You can register for our newsletter. The American Health Dispatch comes out every Friday morning and shares the current trends and what's happening in the news as it relates to the 5 focus areas. We have a podcast called the American Health Podcast, where we go out and dig deeper into various issues throughout the country, connecting with organizations and individuals who are playing very important roles in their communities to improve the health of those particular areas. And you can subscribe to our YouTube channel, where you can find some of the latest videos that are related to the initiative and the 5 focus areas. As Faria mentioned, our contact information is listed now on the screen. My name is Shane. I'm the Partnership and Engagement Officer. Faria is a Fellowship Officer. Please do not hesitate reaching out with any of your questions should we not be able to get to them today. But now we are going to turn it over to your questions. So I have a number of questions that have been emailed in, and I'm seeing folks typing in questions now. So go ahead and continue to submit your questions, and we'll start with the first one, Faria, which is, how much weight does the GRE test score hold in determining who is awarded one of the fellowships?
Hi, Stephanie. Thanks for your question. So the GRE test score, that's more relevant for your MPH admissions. On the fellowship side, we consider all applicants that have been admitted to the MPH program. And we do look at everything you submitted for the MPH and also your fellowship application forms, but the greatest weight is put on your fellowship application forms, the applicant form and the organization form. We don't put too much importance on what your GRE score is, but if you have specific questions about the GRE, it would be a good idea to speak with the MPH program office to learn from them what kind of scores they are looking for admission into the MPH program. And if you send me an email later on, I would be happy to connect you to the MPH program.
Thank you, Faria. Another question, I'm seeing a couple of questions about the DRPH program. So the first one that we have, Faria, is the timeline. It says how the program completion timeline differs. Okay, so how long does it take for folks to complete the DRPH program?
So, Nicole, the DRPH program is offered part-time only, and typically it takes 4.5 years to complete it. But the DRPH program is generous in that it allows up to 9 years to complete the program, which is really a long time, and I don't think it would take that long. But on average, 4 to 5, you can say, doing it part-time.
Great. And then another DRPH question, Faria. Are the courses for the DRPH program part-time and continuous year-round, do you know?
The DRPH courses, they are offered online. Almost all of the courses are offered online because the program is only part-time. A lot of the courses are available online, and of course there are courses in person as well.
Yeah, and I think one distinction that we should make is the part-time and full-time students terms are both 8 weeks. So there isn't a difference between part-time versus full-time term length. So that's one thing to share. I saw another question about if there's a webinar coming up just for the DRPH program. We don't have a webinar. We won't have a webinar just for the DRPH program. Everything that's been shared with you today generally is the same for the DRPH and the MPH. If anyone has specific questions about applying for the DRPH program specifically beyond the fellowship program, we always suggest that folks contact and directly reach out to the DRPH program. So I'm going to give you the email address really quickly for those of you who have questions for the DRPH program. And that the best way to ask those questions is via their email. So it's jhsph-gre jhsph@jhu.edu. Again, that's jhsph-drph@jhu.edu. So that's the best email address that you can use for folks who have questions about applying for the DRPH program. And if you have questions for the fellowship program, it's essentially the same. The same questions are being asked. You still apply with your collaborating organization. All right, so another question we have here, does all the materials need to be submitted at once? Or can folks submit information as they have it, such as a recommendation letter as they receive it?
So Stephanie, yes, you can submit your materials as they come in. It takes time to get transcripts and your recommendation letters. So as you get these materials, you can submit them as they come in.
This is a really good question. I appreciate this question. Is there a specific time commitment that applicants should be employed by their employer, full-time employer, before applying to the Fellows Program? And the example that they used is the 2-year requirement that the MPH program has. And that 2-year requirement that the MPH program suggests is 2 years of relevant work experience after your baccalaureate degrees. So Faria, do we have a number of years requirement to be working with an organization?
No, Farjana, we don't have a specific number of years. You're right in that the MPH program asks for at least 2 years professional experience. And so applicants need to have at least that much to apply to the MPH program. But on the fellowship side, we're not looking for a specific number of years, as long as that applicant can show a demonstrated, commitment and track record working in one of the 5 focus areas here in the U.S.
Another question, is this opportunity open for international students?
So Jaya, there is no U.S. citizenship requirement to apply to the fellowship. The basic eligibility is that applicants should be working in one of the 5 focus areas here based in the U.S. for a U.S.-based organization.
All right, so here, another really great question. Are the MPH courses in environmental challenges customizable? It seems like Jennifer was able to take courses that directly related to her work. Will there still need to be required foundational courses, i.e. for the MPH requirements?
So Farjana, the MPH program does have core courses that students must take, and they also have a generous amount of electives where students can choose the various courses they would like to take. On the fellowship side, we do ask fellows to take specific courses within their focus area, but you'll find that there is a wide variety of courses and enough electives to choose, in your case, environmental courses that you would like to take. And Jennifer, if you'd like to jump in here and say a few words about your courses.
Oh, yeah. So for the environmental challenges area, there's a minimum of 18 credits required. So the whole program is 80 credits. And like Faria said, about half of those are general program requirements. And those are broken down into categories where you can, choose, what kind of class you might want to take for your biology elective, for example, or for your statistics coursework, for example. So you have about half are general requirements. And then another 18 credits are for the focus area. And then you have about another, I would say about 25% of open credits where you can just take whatever you want. And I found that a lot of the credits, or a lot of the courses within the required environmental challenges classes, there were classes that I would want to take anyway. And two, I can list off some of them, but one of them is the climate change class that I mentioned. Another one was a food systems class. There's a couple that I'm going to take on risk sciences and public health and systems thinking in public health. Later, I'll take a built environment course, which is also required. And then there's a category to fulfill. You have to take some kind of either an advocacy-based class or methods-based class. And so I chose the community organizing class.
Yeah, and I think another thing, thank you, Jennifer, and another thing I would like to point out is that you know, one of the questions, we have a few questions that were emailed in, and one of the questions mentions that, you know, their work falls within multiple focus areas, and do they have to apply into just one focus area? Which, yes, you do need to apply into one focus area as an applicant, but our classes, these classes are public health courses, and so you have the opportunity to take courses that might be related to other focus areas as well. Another question that's been emailed in, Faria, is this individual has been out of school, have completed their baccalaureate education 15 years ago, and are slightly concerned about starting up another academic program. And so their question for us is, what types of supports or opportunities does the initiative provide to individuals who have been out of school for a number of years?
Yeah, well, that's a great question. You know, many of our fellows have been out of school for 10, even 15 years. And, you know, I always tell them that, you know, in the fellowship program, we want to support all our fellows and ensure their success. And so we offer academic support. For example, some fellows haven't taken courses like biostats or epidemiology in a long time, and we have academic support where we have tutors to work and coach our fellows, and the initiative covers the cost of all of these sessions, and there isn't a limit to it. If you need the help, we are here to support you, and it's all covered.
Yeah, thank you so much for that. And another question is, who within the collaborating organization should complete their section of the application form?
Well, that's a good question. We don't require a specific person in your organization to complete the form. Typically, it's usually the applicant supervisor or another senior member of the organization. And it's really up to the applicant and the organization to decide who would be the most appropriate person to complete the application form.
A couple more questions from participants on the DRPH program. Thomas has a question about how broadly defined is environmental challenges, and shares about the work that they're doing and hoping to research. I would say, Thomas, it's a really specific question. I would definitely suggest that you contact us, and we can certainly talk more about what it would look like. I think that the work that you're doing certainly would fit into the environmental challenges. Another question from another participant is reaching out to the faculty ahead of time before applying for the DRPH program. Faria, I think that's also something that they can
would
do.
be a really good thing to do. And when you go on the website, you're going to find a faculty directory, and you just, you know, their emails are available, and faculty are always open, you know, for inquiries, and you should feel free to contact them with questions. The other thing is, Thomas, I wanted to let you know that the email that Shane mentioned earlier for the DRPH program, for your specific questions, I would say that you would contact the DRPH office and set up a time to chat with them about your interests and your focus area and how that would fit into the DRPH program.
Yeah, thank you. And we're going to provide the email address also in the chat function for folks who are wanting to make sure that they have the correct email address. So you can go ahead and copy that and use that email address to connect with the DRPH office. Another great question, what level of commitment is expected of the organization other than submitting the collaboration portion of the application? Paul, if you're still with us, would love to hear from you about what you feel like other requirements are to being a collaborating organization.
Well, Shane, you guys are, admittedly, you make it pretty easy for us. I feel like we get more than we have to give, but there's been, you do have your annual gathering, which obviously our participation is helpful in that. Again, like I said, when we go there, we're getting a lot of information as well as participating. And it's just, I guess, in terms of Jennifer's time, it's, you know, creating the space for her to be able to practice and also learn and reflect. And so for us, it's, you know, it's required allowing her a flex schedule to be able to participate. There are a couple times when she needs to be in Baltimore for in real life classes. And so we need to allow time for that. And that's, that's above and beyond other leave that she might take for personal reasons, just to recharge and so on. So, it has had an effect upon, how many on-the-job hours Jen's able to contribute to the organization. We feel that the trade-off has clearly been there, and we've been able to absorb that with other staff helping to, get the things done that have to get done in the hours that Jen is taking away to learn. But again, I just can't say enough about the trade-off. So they're certainly there.
Yeah, thank you, Paul. And, just to add to that, we have no additional requirements. Certainly, we ask that the organization, as Paul's mentioned, provide that space for your learning and support. But as it comes to what else is expected of the organization, we really don't have, there's a letter of commitment that they will sign, not to get too much into the weeds, but it really is no other like weekly or requirements of participation that we look for from the collaborating organizations. Rather, we really view it as how can we support your work, collaborating organization, and improve the impact that you're making. And so kind of meeting folks where they are. I think that we have gathered and answered the majority of the questions, at least, that were posed to us today. I believe that we've gotten through the questions that were posed electronically in advance of the webinar. So I would like to take this opportunity to thank Jennifer and Paul from joining us from Michigan today and taking the time to share your experiences with everyone on the webinar. Thank you to those of you who have logged in and your interest for the Bloomberg Fellows Program. Please keep us posted on your application progress. If you are intending to apply, drop us a note and let us know. We're always excited to hear from folks as they're applying into the program. Any questions at all, please do let Faria or myself know, and we look forward to talking to you about any of those questions or concerns. Folks, thank you so much for spending some time with us today. We hope you enjoy the rest of your day, and we look forward to reviewing your application soon. Bye-bye.